One of the biggest myths about scoliosis bracing is that bracing causes muscle atrophy. In fact, that's one of the biggest fallacies that patients are told by medical providers and orthopedic surgeons that simply is not true when we're talking about specific types of bracing. Hi, I'm Dr. Chris Gubbels. I'm the head clinician here at ScoliCare Denver, and today I'm going to help clarify or demystify some of the myths about bracing and do they or do they not cause muscle atrophy. Now, one of the biggest differences when we're talking about custom braces like scoliosis braces and a traditional LSO brace or off-the-shelf brace is they act completely differently. This is a typical off-the-shelf LSO brace that is frequently prescribed for people that are having chronic back pain. And the way these braces are designed and used, they can cause muscle atrophy if they're used too much. In fact, these are usually intended for treating acute back pain. They're not supposed to be worn more than about 4 hours a day, and then potentially someone will wear them if they're going to do something that could potentially irritate their back. And it's because of how these braces work that a brace like this, it actually could potentially cause atrophy. So these are braces that someone would put on, and they go around someone's torso, and they can make some adjustments to fit them. And then you take these bands and you're going to stretch and pull and tighten this around your abdominals. Now, when you're wearing a brace like this is basically acting like one of your deep abdominal stabilizing muscles called your transverse abdominals. And your transverse abdominals go around your trunk almost like a tube. When you contract them, they're designed to squeeze and stabilize and support your spine. But if those muscles have become weak, this is a brace you can put on that kind of acts like that, which is very similar to like a weightlifting belt. So this is something someone can use and kind of decompress the spine to some degree. It supports the spine, and these can be very beneficial if someone's having acute back pain, or if someone has chronic back pain, they may use these from time to time if they have a flare-up, if they're doing some kind of lifting that they're worried may offset or injure their spine. But these are not designed to be worn all the time, and these are completely different than a custom scoliosis brace like the Scoli brace. As you see, this one goes around me and it's squeezing and holding and restraining my spine. When we think about a scoliosis brace, like the ones we use here at ScoliCare, the Scoli brace, the brace is designed completely different. This is a custom scoliosis brace for someone that has a lumbar scoliosis. And this is the brace we frequently use in adults that have a degenerative scoliosis. When you see this is not a symmetrical brace. You can see it's actually very asymmetrical. If we look at the inside, you can see that it's asymmetrical too. This would be actually a brace designed for someone that has a degenerative or a lumbar scoliosis, and it would derotate the spine here, and it has space over here for the spine to move into. So this does not actually squeeze the spine. There is room for the spine to move into. What it does, it stabilizes and supports the spine, not squeezing. It has a derotational force, and it has a room for the spine to actually move into. So because it's not squeezing the spine like the previous off-the-shelf brace, it does not cause any muscle atrophy. And so one of the biggest reasons a brace like this does not cause muscle atrophy is because it designs and functions completely different than a typical off-the-shelf brace that is squeezing the spine. This actually allows the spine to move inside the brace. The second reason these braces do not cause atrophy is your body actually gets stronger when you recover, not when you're physically doing things. If you think about if you were exercising, you were lifting weights, if you were doing that non-stop or even back-to-back days, over time you would actually get weaker because your body has to recover. If you have a degenerative scoliosis or a painful scoliosis, your muscles are having to constantly work to try and support and hold your spine upright. But we find when patients have a custom brace that supports their spine, it gives their muscles a chance to relax. And when your body has a chance to relax, those muscles can recover and actually rebuild. Also, when your muscles get a chance to relax, they're not having to strain just to hold yourself up. That also does a lot to just decrease overall pain. So the second reason is it supports your spine and actually allows your muscles to rest and recover, which actually makes your body stronger. And the third reason the custom scoliosis braces like Scoli brace do not cause muscle atrophy is they're typically combined with scoliosis-specific physical therapy. In fact, ScoliCare recently did a study where we were looking at adolescents that were wearing scoliosis braces up to 23 hours a day. At the beginning of the study, we measured their abdominal and erector muscle strength and endurance, and then we also measured it later on after they had been wearing the brace for up to 23 hours a day. And when they were wearing a brace, along with doing scoliosis-specific exercise, in this case, ScoliBalance exercises, and 100% of the patients actually had an increase in abdominal and erector muscle strength and endurance when we combined the custom Scoli brace with ScoliBalance scoliosis-specific exercises. So if you're watching this and you've been told that you shouldn't wear a brace because it'll cause muscle atrophy, you need to look into what type of brace they're talking about. Because yes, an off-the-shelf brace that squeezes your spine if worn all the time, that type of brace can cause muscle atrophy. But a custom brace like a Scoli brace that supports your spine and allows for movement and in some cases corrects the spine, those do not cause muscle atrophy, especially when combined with scoliosis-specific exercise. So if you're watching this video, you likely, or someone you know likely has scoliosis, you may be wondering what can be done for you. What I'm going to encourage you to do is click on the link below, request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. We can go over the severity of the scoliosis, how likely it is to progress, and what treatment options you're a candidate for. And to learn more about the best non-surgical treatment options for scoliosis, click on our next video, and I'll see you there.